Good morning. Thank you, Chairman Crapo, even though he's not here, and Ranking Member Wyden, for the opportunity to be here today. My name is Bartley Armitage. I live in Eugene, Oregon, with my wife, Carla, who's sitting behind me. Carla was a teacher for 25 years. Together, we raised our son and 2 daughters, and now have 3 granddaughters who we love to spend time with. Carla and I worked our entire lives. Our parents didn't have a lot of money. My father died when I was 12 years old, and my mother, my siblings, and I lived in the basement of an old hotel for many years as we were growing up, counted on food stamps. Carla got her first job when she was just 13 years old and worked all through high school. I started working as a pretty small child, walking soybean fields with my grandparents on their farm, and continued to work various jobs from then on. I moved to Oregon when I was 19 years old and spent nearly 40 years working various construction, but as a carpenter for 37 years. Working my way up from an apprentice to a journeyman, then to a foreman, and finally as a superintendent in charge of the contract for the company I work for. I was on a lot of major projects in that area with a lot of overtime. When you become a superintendent, you have to work a lot of hours, to say 10 to 12 hours sometimes, just to get paid 8. Working construction takes a toll. I retired realizing I could no longer compete physically with 25-year-olds who were in their prime. For all my years of construction, I was worn out. You get worn out. I needed a couple knee surgeries and a hiatal hernia surgery. Carla dealt with more demanding health issues, suffering from a chronic fever that we believe was caused by a toxic black mold. She and our daughter spent years going from doctor to doctor trying to get a diagnosis for that. We ended up having to move out of our home. It still affects her today. My wife also had a necessary surgery several years ago that cost tens and tens of thousands of dollars just for a 7-hour hospital stay. It took us several years to pay off the debt that the insurance didn't cover. I can't even imagine what it would be like to navigate that situation without health insurance. Nobody wants to pay that kind of bill for 1 month. Most can't afford it. A bill like that is like having to pay for 2 houses. A bill like I will be looking at, which would be 5 times what I'm paying now. We're worried about having to deplete our retirement savings to pay for health care. We worked hard to raise three children, save that money, and on not really that great of an income. Our savings is what we plan to retire on and to have in case we need to eventually go to a nursing home and other things that could come up. It's there so we have a decent life, and some of the things that nobody really wants to have to deal with. Since we shared our story, we have heard from so many people who are in the same boat as us, struggling to figure out how we're going to move forward with these costs. And before I conclude, Carla asked me to share a couple thoughts on her behalf. First, of course, we want to be around to see our granddaughters grow up. Our fear is that without health insurance, we won't be able to go to the doctor if we're not feeling well and face those consequences. We know people who haven't had the opportunity, and it breaks our heart to think about what they're going through, missing out on life because they couldn't afford to get the care that they needed. Second, making health care affordable for everyone is the type of thing we expect our tax dollars to go toward. In a country like the United States, where it's a good country, it's a strong country, and it's a rich country, people should not have to go without care. I'm honored to be invited here today to share my experience on behalf of millions of other American families who are facing the same shock that we are. I urge you to take action that keeps our health costs affordable before we're hit with a massive bill like this January. It's literally overnight. Thank you, and I look forward to your questions.